And I sat there for the next 2 to 3 hours and worked my way ablating the fibroid little by little. Saw that the entire fibroid was killed. Patient got off the table and said, "When can I go to work?" And we were just sitting there with our mouth agape like, this is incredible. And that was my entree into focused ultrasound.
Welcome to Curing with Sound, a podcast presented by the Focused Ultrasound Foundation. I'm your host, Allison Preston Smith. Today, we're speaking with another resident expert at the Focused Ultrasound Foundation. Dr. Suzanne LeBlang is the Director of Clinical Relationships and collaborates with various researchers, clinicians, and manufacturers utilizing focused ultrasound technology, as well as nonprofit partners. Susie has extensive clinical experience as a neuroradiologist and has performed hundreds of focused ultrasound procedures since 2004. She has also published numerous papers and frequently presents on emerging research in the focused ultrasound field. She earned her BA in biology, Doctor of Medicine, and completed her radiology residency and neuroradiology fellowship all through the University of Miami and at Jackson Memorial Hospital. Welcome to the podcast, Susie.
Hi, Allison. Thank you so much for having me. It's such a pleasure to be here.
You were an early adopter of focused ultrasound before it became more widely known. Can you talk about your first experience using the technology?
Sure. So it was really a fascinating year going back to 2003 and 2004, right? So in 2003, I was in a combined private practice / research setting. And the owner of the practice decided that he was going to buy the first focused ultrasound machine after FDA approval pending in 2004. So in 2003, we sat in on a lot of the in-services from the company Insightech to learn about the machine, to learn about the technology. And at that time, I was about 8 years out of training. And I sat there and I was like, this is crazy. Like, we're going to do kind of non-invasive surgery in my generation? Like, you're going to be able to put an ultrasound machine on top of a patient and change the inside of the body without any incisions. I couldn't believe it was true, but I was fascinated sitting in those lectures. Then it came time to do the first procedure in 2004, which it was approved for uterine fibroids first. And as a neuroradiologist, I was not slated to do the procedure. One of the other partners in the practice was slated to do it. And that morning, it was super exciting. Everyone from the company was there. People from the FDA were there. The press was there. You know, it was, the control room was filled with people. And this other radiologist I was supposed to work with was going to do the procedure. Fantastic. 7:00, they put the patient on the table. The other radiologist doesn't show up. 7:15, doesn't show up. It turns out that he had some medical issues and had to go to the hospital that morning. And I got a call from his wife and said, Susie, since you are a female physician and you know where the uterus is, I think you should do the fibroid procedures, because I was the only woman in the practice at the time. I was like, wow. I go, that's impressive. I know where the uterus is, so I'm going to do this procedure. And I was like, okay, let's sit down and do it. And I'm not going to lie to you, I was nervous, right? They wanted me to press a button and have this machine go through the patient's skin, through the patient's abdominal wall, and heat the fibroid up to 60 degrees Celsius, which is like 160 degrees Fahrenheit, and treat a fibroid. I was always used to catheters in patients and doing things where I could touch and feel it. But this was trusting a computer to do something. This was completely new at the time. But I sat down at the console. The representative from the company kind of sat next to me, and we dotted our I's and crossed our T's, just like we learned in the in-service. And sure enough, after the first sonication, where I could see the temperature rising inside the fibroid and no temperature rise outside of that target area, and definitely no heating of the skin or the abdominal muscle. And the patient was lying there awake, basically felt a little bit of pressure and a little bit of heat. I was like, this is incredible. And I sat there for the next 2 to 3 hours and worked my way ablating the fibroid little by little, injected the contrast at the end, saw that the entire fibroid was killed. Patient got off the table and said, when can I go to work? And we were just sitting there with our mouth agape, like, this is incredible. And after that, I said to myself, I just want to do this all the time. And that was my entree into focused ultrasound.
No pressure. Just jump in at the last second. And that experience led you to publish in Radiology in 2010, a significant milestone for focused ultrasound research. Can you tell us more about that?
Yeah, sure. From 2004 to 2008, the years passed quickly, and I was so fortunate to be able to treat, hundreds of women, very early on with focused ultrasound. And it was really interesting to look at the data to see how do you optimize treatment and decrease side effects. So I was very fortunate to have a team with me look at the data, and we were able to publish those early results. And it was just the beginning of the fibroid story, but I think we really helped understand that the more tissue you killed, or the greater the non-perfused volume, the more shrinkage and the better the patients fared after. So it seems like a simple concept, but you need data to prove it, right? So we had that data, and I thought it really helped the field and other researchers and other clinicians that were doing the procedure really push the limits of the treatment to improve the lives of these patients and optimize the treatments and decrease the side effects. So we know how to do the treatments better and safer. So again, my study was just the beginning of it, but it really helped other researchers continue that.
And you've shifted to focus more on neurodegenerative conditions like Alzheimer's and Parkinson's. So how is focused ultrasound being used in Alzheimer's research?
So focused ultrasound is used in Alzheimer's research in many different ways. To start the story off, at first, it was really just doing blood-brain barrier opening, right? And in preclinical models, they really showed that you could safely and reversibly open the blood-brain barrier with focused ultrasound. So that involves giving microbubbles intravenously and then sonicating, delivering focused ultrasound to the brain. Those microbubbles oscillate. They get bigger and smaller in the area of the focused ultrasound beam. And what that does is open the blood-brain barrier. Those vessels in the brain that are normally very tightly regulated so that toxins from our system or any bacterial infection we have doesn't go into our brain, right? But we want to open that blood-brain barrier in a controlled fashion to let important therapeutics through, or our own immune cells to get into the brain to see diseases. So what they showed in preclinical models was that you could open the blood-brain barrier, and in preclinical models with Alzheimer's disease, you were able to decrease the amount of amyloid and tau, and importantly, improve cognition. So eventually they translated that into clinical work, and there have been probably a dozen studies now in patients where we can safely and reversibly open the blood-brain barrier in patients with Alzheimer's disease. And it has been shown to decrease amyloid, and we're starting to see some suggestion that we can improve cognition. Now, that's just opening the blood-brain barrier alone. What's really exciting now is doing the blood-brain barrier opening in combination with increasing drug delivery. So if we open that blood-brain barrier, we let our immune cells in to see the amyloid and tau, but now we can let increased amounts of drugs go through. Because without the blood-brain barrier opening, some of those drugs can't get through at all, or get through in minimal amounts. So what's been really remarkable in 2024 was the first published result in the New England Journal of Medicine that came from the group in West Virginia University and the Rockefeller Neuroscience Center, that this is amazing. You ready? In the side of the brain where they delivered the focused ultrasound, there was dramatically decreased amounts of amyloid compared to the side of the brain that didn't receive the focused ultrasound. So now in theory, when you inject a drug intravenously, and at that time it was Aduhelm, in theory, the drug should go everywhere, right? But only on the side of the focused ultrasound did the amounts of amyloid markedly decrease. So you have to think that there was increased drug delivery to that area, which allowed the removal of amyloid more on that side. So that was really dramatic. There's been some recent research out of South Korea, who have been pioneers from the beginning in Alzheimer's disease. But now their latest research shows that opening the blood-brain barrier in larger areas of the brain and on both sides of the brain in patients with Alzheimer's disease has been shown to decrease the amount of amyloid and improve their clinical outcome scores. And what's really important about this study is that they are showing clinical benefit in doing the blood-brain barrier opening alone, even without the drug. And there's one more thing with Alzheimer's disease. So we can do blood-brain barrier opening alone. We can do the blood-brain barrier opening with delivering a therapeutic. And there's also neuromodulation, right? So doing the focused ultrasound at even a lower power and neuromodulating the cells in that region have been shown to improve cognition in patients with Alzheimer's disease. So, the truth always kind of lies somewhere in the middle. There's probably a little bit of advantage of opening the blood-brain barrier alone. There's advantage of delivering more drug, and there's advantages of delivering neuromodulation. So we're continuing to really support research along all of these areas to optimize all of these techniques.
Are there any other promising studies that you're keeping an eye on?
Yeah, with Parkinson's disease, it's kind of the same thing. We can treat symptoms now by doing ablation of certain targets to treat the tremors or the dyskinesias, but can we treat the underlying disease? So in Parkinson's disease, there's a study going on in Sunnybrook Hospital in Toronto, and they're delivering Cerezyme to a very certain part of the brain called the putamen. And what we're hoping to do is really increase the amount of dopamine levels. So again, we're changing the paradigm here. We're starting to see if we can treat the disease and not just the symptoms. So we're very excited about following that study as well.
We're also seeing focused ultrasound being used in treatment for mental health conditions and addiction. So what's going on in that area?
So it's been an exciting year for the treatment of mental health and psychiatric conditions with focused ultrasound. And I think the public awareness that we're in a mental health crisis, right? 1 in 5 people now suffer from some kind of mental health disorder, and especially our teenagers, right? There's been a dramatic increase in the amount of mental health disorders in our teenagers, probably from the COVID pandemic, other stressors in life. But we really need to address this issue, right? Most patients with mental health issues start with cognitive behavioral therapy, and then they may progress to needing medications. Medications have side effects. 20 to 60% of people are medication refractory, meaning the medication doesn't work. So then the other option is really jumping to potentially invasive treatments, which are quite severe in patients with mental illness to begin with. So maybe there's something in the middle. So people are using other forms of neuromodulation with transcranial magnetic stimulation or direct current stimulation. But focused ultrasound really provides a unique opportunity to do incisionless, non-invasive neuromodulation. And the benefit of focused ultrasound compared to other treatments involving neuromodulation is that the focused ultrasound beam can penetrate deep into the brain and target some of the areas of the brain responsible for some of these psychiatric illnesses that TMS and DCS can't do. So those other conditions can only kind of penetrate a little bit and achieve neuromodulation of superficial targets. Focused ultrasound can do the superficial targets and the deep targets. And would you believe we can now address 8 conditions in clinical trials with focused ultrasound and neuromodulation? All right, you ready? It's depression, anxiety, schizophrenia, OCD, obsessive compulsive disorder, addiction, autism spectrum disorder, post-traumatic stress disorder, and attention deficit hyperactivity disorder. So think about the impact we can really have on society. So we're really excited about following these clinical trials and supporting these clinical trials, supporting more preclinical research in this area, helping manufacturers design machines that can be more easily used by the patients and the physicians to really make sure that this can be adopted in a fairly easy fashion and democratize healthcare among various populations that really need help with mental disorders and psychiatric illnesses across the world.
And you've spoken with researchers who are leading clinical trials in immunotherapy and breast cancer treatment as well. So how are they using focused ultrasound in these studies?
Yeah, so breast cancer, again, important public health. I'm going to call it a crisis, right? 1 in 7 women now have breast cancer, me being one of them, right? So I can tell you from personal experience that I had to go through the surgery, the chemotherapy, and the radiation. So let me tell you how focused ultrasound can address all of these issues for patients that need maybe 1, 2, or even 3 of those treatments, right? So you can use focused ultrasound to thermally ablate early breast cancers, right? Thermal ablation is the most well-known mechanism of action of focused ultrasound. You can just kill the lesion, kill a margin around it so you have a negative tumor margin, and perhaps obviate the need for a lumpectomy or mastectomy in the future, right? So great, thermal ablation. How about for the chemotherapies or immunotherapies, right? So right now, if you're given a chemotherapy agent or immunotherapy, hopefully it attacks the cancer, but it also affects normal cells. And that's why you get a lot of side effects from chemotherapy. You can get leg swelling, you can get lung problems, cardiac problems, even changes in the brain, right? Lots of side effects from chemotherapy. So perhaps if you can do targeted drug delivery with focused ultrasound, meaning that you deliver a chemotherapy or an immunotherapy agent inside a nanoparticle and only deploy it, only let it aggregate in the region of the tumor, you can get increased drug to the area of the tumor, which you want it to help kill, and decrease side effects to the rest of the body, right? Another way to do it is that you use focused ultrasound to change the immune environment of the tumor itself from like a cold area where we don't have a lot of immune cells helping to fight the cancer to a hot area where a lot of immune cells will come in and help fight the cancer. Because I don't think a lot of people know that every day you, me, and everyone listening, we have cancer cells inside our body all the time, but our immune system keeps it at bay. It keeps it in check and fights it. It's when our immune system is not working well that the cancer starts to grow and manifest, right? So we want to engage our own immune system to help fight it. So by doing focused ultrasound, you can actually help release some tumor antigens from the cancer cells, ignite our immune system, and then our immune system will fight possibly not only the primary tumor, but also some of the metastatic foci. And we've seen that in a bunch of tumors, and that's called the abscopal effect. And so not only can it help with breast cancer through thermal ablation and drug delivery and immunotherapy delivery, but it can also help with radiation. So characteristically with radiation right now, one of the side effects is that you really get a burn, not only on the area where they're delivering the radiation, but also out the backside. And there's also radiation damage to whatever tissues are in between, like lung tissue or soft tissues, which can be quite debilitating. So with focused ultrasound, a very interesting study, early results were just published out of Canada and Sunnybrook with Dr. Zarnata, and it showed that doing focused ultrasound, in addition to traditional radiation therapy, enhanced treatment efficacy. And again, these are very early results, but the study is now being involved with a larger number of patients. So if we can optimize the treatment, we can give focused ultrasound, give less amounts of radiation, still have improved efficacy, but also decrease those side effects. And importantly, also leave room for if the cancer happens to come back, there's still enough radiation left to retreat the patient. Because sometimes if you max out on radiation the first time, you can't ever get it again. So it was really fascinating research coming out of Sunnybrook and important research for millions of women that suffer from breast cancer and have side effects from radiation.
Part of your career has been in academia at the University of Miami Medical School, Florida Atlantic University, Schmidt College of Medicine, and you've been a visiting faculty member at several universities, including Harvard and Ohio State University. What do you enjoy most about working in academia?
I think academia really set the groundwork for me being able to work as a team, right? Or work in a team setting, which I've always enjoyed. And going to these universities and seeing how many smart, dedicated researchers and clinicians there are has just continuously, had me in amazement. And part of my job as the director of clinical relationships is going literally around the world and trying to put the right people together to form these teams to advance research. So when we find interesting preclinical research that has sufficient and sound data, we then want to know how to translate that research into clinical trials and ultimately commercialization and help patients. So it's that translational work that's fascinating. So you have to identify the right preclinical labs, the right clinical team, put them together, get people working together, sharing knowledge in a transparent fashion to help move the process forward.
What's it been like seeing the rapid evolution of this technology since you first started your career?
So when I first started training, they did surgery with open surgeries, right? Open hysterectomies, myomectomies for fibroids, taking the gallbladder out, you still needed a big incision. And then it went to laparoscopic surgeries where you could do just a few little holes and still take out the uterus or take out, the gallbladder. And now we're doing completely incisionless surgery in my lifetime. And I'm old, but I'm not that old. So think about how much has happened just in 30 years since I finished my training, right? That's rapid advancement of medicine. And thinking about now we're optimizing focused ultrasound, not only in ablation, but drug delivery and neuromodulation. Think of how we can treat so many diseases inside the body without surgery. And that's why focused ultrasound is such a versatile tool, and why the Focused Ultrasound Foundation is so important, because we're really addressing all of the potential benefits of focused ultrasound, which is a monumental task, right? Because from when I started, there were a few indications for focused ultrasound. Now in our pipeline and our rainbow chart, there are over 171 clinical indications at various stages of preclinical research and clinical research in focused ultrasound. So if you think of a disease process, we're probably also thinking of it and or addressing it already with focused ultrasound, right? So I think of how far we've come in 30 years, and to think, hopefully I'll be doing this at least another 20 years, where it's going to go in another 20 years. So I'm really excited to see the future of focused ultrasound, and very excited to be a part of the Focused Ultrasound Foundation and work with the team here and around the world, all of our compatriots and all of our teammates, to really advance the field.
And how can listeners support the work of the foundation?
Oh, there's a lot of work everyone can do. Number one, help us spread awareness, right? Sign up for our newsletter, see all the new and interesting research and ideas that are coming out, and talk to your friends, talk to your coworkers, talk to your family members. If you hear of them suffering from one of the diseases that we're already addressing, have them go on our website, have them contact us, right? So one is increase awareness, increase education around your own ecosystem. The next thing you can do is, if you're really passionate about a certain disease process or a certain clinical illness, get involved with us. Help us network to other nonprofits that are also dealing with a certain problem. Help us make connections to other people in the field that you may know, so we can form these bridges and connections and work with them to advance that initiative. Right? We really want to optimize the technology and, importantly, support clinical research. Unfortunately, clinical research is very expensive. Fortunately, clinical research is being done out there because patients want to improve their life. They want to improve their quality and quantity of life, right? And they realize that focused ultrasound offers so many advantages because it is incisionless, right? So you can help us support research in any manner through education, awareness, funding, and just being part of our team.
Well, thank you so much, Susie. It's been so great talking to you, and thank you for all your contributions to the field.
Thank you for having me. Thank you.
This episode of Curing with Sound has been presented by the Focused Ultrasound Foundation. If you'd like to learn more about Focused Ultrasound or the Foundation, visit our website at fussfoundation.org. You can also sign up for our newsletter and follow us on social media. Be sure to subscribe to the Curing with Sound podcast so you don't miss the latest information about Focused Ultrasound. You can also rate and review the show.